Hello, my name is Phil Herman. I'm Superintendent of Hudson City Schools, and thank you for tuning into this week's Monday message on Tuesday. We have completed 4 weeks of school in the hybrid model and with our students participating in the virtual learning option as we begin this 2020-2021 school year. We have so much to celebrate with students back in the buildings, participating online, and many students engaged in extracurricular activities as we get this school year underway. As well as many of those activities are going, we also know that the hybrid model is challenging for some students, whether that be academically, from a mental health perspective, or social emotionally. So thank you to the parents and the teachers who are working so hard to support our students this year as we get underway in this unusual model for schools, and we have been for the last 4 weeks. Today's message is going to focus on our Option 1 educational delivery instructional models and the possibility of transitioning to an all-in model. Back on August 10th, the Board of Education passed a resolution that we would begin the school year in hybrid instruction. At that time, we shared that parents should expect that we will be in the hybrid through at least the end of September. Since the beginning of school, there have been some good signs for schools in our region. First of all, the case rates in Summit County. I'll put a graphic up here and share with you that shows the cases and the 7-day average from August 1st through September 19th, which was the most recent data that we have. We'll get another update this week. And you can see that particularly that 7-day average line is an important indicator for us as we continue to watch that line decrease down to a lower rate through that period of time. So that's one good indicator. During that same period of time, as a county, we moved from orange to red to yellow and back to orange. And that can be confusing as originally I think many of us thought that the color coding was sort of a direct correlation to that number of cases in that line that I was just showing you. And when in reality, there are certainly ties to the prevalence of spread in the community and the color coding, but even a few cases we are learning are able to escalate into a higher color coding or as we saw jumping from red to yellow, quickly move us to a lower level. So we're learning more about which of those 7 components that make up the color coding are those that affect schools the most. And certainly that first indicator I showed you, the cases per 100,000 in a community, is one of those really important indicators for us as a school district. Another really good sign are that we're watching closely the school districts in our area and around the state that have opened all in, whether that be Wadsworth or Aurora or Revere, and looking at their cases of COVID as compared to our cases of COVID and finding either similar rates or lower rates in those 3 examples that I gave you, but certainly watching school districts that have opened all in. That's a good sign as well. And then, of course, we're looking at the cases in Hudson City Schools and how they have been manageable. In those first 4 weeks, we saw 7 cases, 7 student cases, 2 staff cases. And then just yesterday, we had a middle school and high school student. We received information that they had tested positive. So we've had 9 student cases and 2 staff cases since the beginning of the school year. And so that has been very manageable in terms of those cases. And the best part of examining those situations is the fact that to our knowledge, as we do contact tracing in each one of these cases, they have not been cases of in-school spread. And so that's a really important indicator and something for us to watch closely moving forward. Last week, the Board of Education had a work session on Thursday evening where we reviewed the original Hudson Ready Back to School plan and the guiding principles. And from day one in our planning, it has been a guiding principle to provide in-person instruction for all attending students as much as possible. It's also been a guiding principle to build a safe plan, to follow the guidance from the Center for Disease Control, the Ohio Department of Health, Summit County Public Health, and the Ohio Department of Education to develop strategies and processes to keep our students, our staff, and our community safe. We also, at the work session, reviewed the Summit County Public Health August 10th guidance for schools and the criteria that they had listed at the time for schools returning all in. We reviewed Summit County case numbers and the cases we have in Hudson City Schools. And we reviewed the latest CDC guidance issued for schools on August 15th, and specifically looked at the suggested safety protocols or mitigating strategies of how we're implementing them now, those strategies, how we're implementing them now, and what would change if we were in all in. After review of each of these items and the discussion that followed, it was decided that the board will continue the conversation and be prepared to consider a resolution to transition to all in at the next regular meeting on October 12th, so the next regular Board of Education meeting. In the meantime, we will be sending a survey this week to learn about our parents' perspectives on the hybrid experience thus far. We want to learn about that while it's fresh right now, and also ask for their feedback and comfort level with the transition to all in. So please watch for that survey. Additionally, between now and then, we will continue to closely track the case rates in Summit County, particularly also looking at the cases in the 44236 area code, the cases in Hudson City Schools, and as I mentioned before, the experiences in districts around us that have opened or are transitioning to all in their educational delivery models. As we think about transitioning to all in, it is important for us to recognize a few points. First of all, from the beginning of the school year, we have layered the recommended main mitigating strategies or safety protocols, including assessing for symptoms, consistent use of masks, social distancing to the greatest extent possible, and that means 6 feet in our classrooms currently, enhanced cleaning and disinfecting, and hand washing and hand sanitizing. Additionally, there are secondary mitigating strategies that have included the limiting of sharing of school supplies, limiting visitors, increased outside air ventilation, installation of water bottle fillers and hand wash stations, installation of physical barriers, prepackaged meals for all food service, and then limiting students to 1 per seat on the bus. So how would those mitigating strategies be changed or affected if we transition to all in? There are a few to understand. Most of them are unchanged, but the biggest change would be to social distancing or physical distancing in the classroom. We would be moving from 6 feet in our classrooms to minimum of 3 feet in our classrooms. In some classrooms, we'd be able to be at 4 or 5 feet to have all students in, but that would be the primary change to our mitigating factors. When students are in the lunchroom and they go to eat lunch, we would still be at 6 foot distancing. So when those masks came off, they would be at 6 foot distancing. They might not all be able to eat in the lunchroom. They could need to eat in alternate locations, as some are right now at the auxiliary gym, for example, at the high school. We would need to do some arrangements like that in each of our buildings to make sure that our students are 6 feet apart while they're eating. In regard to transportation, we're currently at 1 student per seat on the bus. On the all-in plan, our statement about that is that we could be at 2 students per seat. Based on the lower ridership right now this year, at this point in the year, as long as the ridership stays similar to what it is, we would still be able to stay at 1 student per seat on the bus in almost every single route, and possibly every single route. But if ridership increases, then we could have some situations where we would have 2 students per seat on a bus. And then in regard to quarantine, an important thing to understand under the all-in model is that, or currently even, when there's a current positive case, students who are within 6 feet for 15 minutes or more of a positive case need to be quarantined for 14 days. Based on the cases we've had a limited number of quarantined students, and we know that if we're all in and there's a positive case, it is likely that more students will have been within 6 feet for 15 minutes. So more students could be quarantined and need to participate in remote learning during that period of time. All other mitigating strategies that I listed remain in place as they are now. So again, we will be continuing the conversation, and be prepared to consider a resolution at the October 12th Board of Education meeting. So please watch for that survey. Please take the time to share your perspectives about the hybrid learning thus far so that we can learn from that, as well as your perspective on the transition to all in, particularly giving us your comfort level on that. Thank you again for your support. Thank you for tuning in, and I hope that you have a safe and healthy week.